Good afternoon, ladies and gentlemen. My name is Brad Isaac. I am pleased to be serving as the moderator for this session presented by Dr. Ross Walker. At this time, I would like to introduce the speaker. In his main platform presentation, Dr. Ross Walker introduced the 5 keys to ultimate health, and in this workshop, Dr. Walker will take a deeper dive into these topics and discuss drug therapies versus natural cures. Please welcome Dr. Ross Walker.
What if they've got it all wrong? And when I say they, I'm talking about conventional medical wisdom. What if we've been fed a whole lot of porkies over the last 30 to 40 years? And I think in many ways we have, and I'm going to go into some of those today. But before I do, I'd like to tell you a story about the inflatable boy. The inflatable boy was sitting in his inflatable classroom with his inflatable classmates, and he said, "I've had enough of this, I'm leaving." So he walks down the inflatable corridor, and the inflatable headmaster came up and said, "What do you think you're doing?" He said, "I'm leaving." He said, "No, you're not." He said, "Yes, I am." Pulled a safety pin out of his pocket into the inflatable headmaster. And he goes on a rampage with his safety pin. He's sticking the walls, he's sticking anyone who comes anywhere near him, runs up his inflatable road into his inflatable house, sits on his inflatable bed and says, "Oh my God, what have I done?" All of a sudden there's a knock on the inflatable door, and it's the inflatable policeman who comes in and says, "You're in trouble, boy." He said, "Oh, no, I'm not." Pulls the safety pin out into himself. He's taken to the inflatable hospital where he's resuscitated, and he wakes up in bed next to the inflatable headmaster, who looks at the inflatable boy and says, "I'm very disappointed in you. You've let me down. You've let your school down. But worst of all, you've let yourself down." And I think in many ways we have been let down by conventional medical wisdom. Now, all through this talk, which I couldn't do on main platform, there will be some shameless plugs for my book. And this is just one of them. This is my latest of 7 books, and I suggest you read them all. This is the 5 stages of health. So everything's in 5s, as I said, in the main platform. And I want to talk also about the 5 keys to optimum wellness. The first thing about feeling well is firstly not to be sick. And we'll talk about disease and how that happens. Secondly, it's about how our body is well. Thirdly, how much energy we feel. Fourthly, optimum thinking. And finally, and most importantly, as I said at main platform, emotional wellness, how happy we are, how contented we are with our life. Now, really, we were just designed to survive, purely to survive. And you can see here, is it about survival of the fittest? Well, I think Darwin said it best when he said, "It's not the strongest of the species that survives, nor the most intelligent, but the most responsive to change." And I think we have to realise in this modern world, we really have to adapt to change very rapidly. And as I said in the session, the problem is we were designed to be hunter-gatherers, and this is one of the consequences of not being a hunter-gatherer. So really, our bodies were designed, you think about it, to live in a natural world purely from feast, famine and movement. So we had the acute feast of the kill, but you might go a couple of days without eating. A lot of my patients come to me and say, "But doc, I get hungry about 10:30. Get over it. Our body was designed for a bit of hunger. You don't always have to have your belly filled. And also our body was designed to wander around a jungle all day, not sit on our backsides. So really, the lack of movement, sitting is probably the new smoking. And we have to think about how much we sit and how bad it is for our bodies. Also, the only stress that hunter-gatherers had was the acute stress of the kill or the acute stress of avoiding being something else's lunch. Not the sort of stresses we have today. It was a very simple, top of the food chain sort of life. But also, let's face it, being a hunter-gatherer sucks. You live 30, 40 years. Now we're living double our use-by date. So you see on this slide, the bee saying, "No more, I can't take it," that incessant buzzing sound, because our world is, and our head is constantly filled with noise and stress and whatever. And I see people, they can't sit in a restaurant and have a conversation. They've got to be on their damn phones. There is a little thing called talking. I went into a cafe and there was a sign in the cafe that says, "No, we don't have Wi-Fi, talk to each other." It doesn't hurt. So we live in a world where we're exposed all the time to synthetic chemicals. And we don't even think about the effect those synthetic chemicals are having on our body. A world that creates obesity because of the sitting, because of the free access to food, because of all the mechanical forms of transport. We live in, and nobody talks about this as well, the increasing exposure to radiation. People constantly have these mobile phones against their skull, and I can assure you there is a direct link between the excessive use of mobile phones and brain tumours. The World Health Organization, which is a reasonably well-respected group of people, put out a statement a few years back saying that mobile phone use is what we call a type 2B carcinogen, which means the evidence is pretty strong that if you use a mobile phone without protection, and I'm not suggesting wearing a condom, I'm talking a mobile phone to the ear for a half an hour a day for 10 years in a row, you increase your risk for the worst form of brain tumour, malignant glioma, by 30%. Now, and I will declare my interest in this, I'm part of a company that makes a thing called a SpeakSafe, which is a little very inexpensive device you put around the cord going into your ear, and it blocks 99.9% of the radiation. And I would certainly not have a prolonged conversation on a phone without using my SpeakSafe. If you use the earpieces, it actually concentrates the radiation into the ear unless you've got the SpeakSafe. And those ridiculous Bluetooth things, unbelievably bad for you. So we've got to think about, and you wouldn't believe this one, ladies and gentlemen. There are people who sleep with a television in their bedroom. Could you imagine how bad that is for your body? The radiation coming off the TV, even if it's switched off. Even I think the effects of Wi-Fi in the home and what they're doing to our body. So the radiation's not good either. Also, our life is chronically stressful. It's the chronic stresses of complex relationships, very complex jobs, very complex travel. We're not just top of the food chain hunter-gatherers anymore. But because we don't live in that harsh environment, we are living double our use-by date, which is age 40. And I can say that with absolute conviction that our use-by date is age 40, because if you look at, say, for example, sportsmen, all sportsmen are at the peak of their career up to their 30s, and then they're not as good after the age of 30 because the body's starting to wear out. So we have to have tricks to overcome all this, which I'm trying to talk to you about. Now, one of the things we keep doing, what we do is because we have 5 basic drives. We have these 5 that you see here. The need for food, because if you don't eat food, you die. Need for good shelter, because there are times when the elements will kill us. Social interaction. The wonderful thing that comes from social interaction, because if we don't do this, we don't procreate the species, and of course the acquisition of knowledge. But here's the problem. No longer do we eat just to fill our bellies. Food has become one of our major life pleasures. And also, the bigger the shelter, the more important you are. That's how many people think. So we don't just live in a cave to get out of the rain. We now have to have very nice shelters. And then there's, of course, social interaction and that activity that leads from social interaction. And then the need for knowledge you see in the animal self-help section here. Now, here's a question for you, and I'll put this question out to the audience. Who are the sickest race on the planet? Americans? Yeah, why do people pick on the Americans? New Zealanders, no. The sickest people on the planet live in Africa. Their average lifespan of people who live in the middle bits of Africa is about 30 to 40. Why? Because they're malnourished. It doesn't hurt to have a little bit of this. It hurts to be malnourished. The worst thing for you. And here's the key to a lot of my work. I'll just show you this here. This is a blood vessel with protein, sugar and fat coming through the blood vessels, and they've got to get into the things below the cells to do their stuff. So the covering of every cell in a healthy person living in the modern society is 75% fat. So fat isn't the evil that we've been told it is. If you don't have a good fatty membrane, toxins can easily get into your cell and kill the cell. So in Africa, because a lot of them are malnourished, they don't have enough fat to act as a protective coating in their cells, and HIV, tuberculosis, malaria, and now there's Zika virus in South America, straight into the cells, kill the cells very easily and cause damage. and then can damage the nucleus or just kill the cell. In our society, the fat that's bad, there's only one fat that's bad. It's not saturated fat. I'll talk about that in a second. It is what we call trans fats, which are the synthetic fats in processed packaged food, which basically get into your cell membranes and do what they do to food. We use trans fats to thicken and harden food, and the trans fats in our body thicken and harden the membranes, so the membranes become very hard, very brittle, and can break down very easily. So it's trans fats that are bad that you get in processed packaged muck masquerading as food. Now, what about people that have incredible longevity? You see here Okinawa in Japan. The people living in Okinawa, the native Okinawans, have amongst the greatest longevity on the planet. They have more people over the age of 100 than any other race. And there are some common things that people that have enormous longevity. I spoke about Ikaria this morning. There's Sardinia. There's the Seventh-day Adventists. All of them don't smoke. Number one, don't smoke. If you smoke, you're not healthy. I said it today. They put family first. They're active every day. They keep very socially engaged. They eat fruits, vegetables and whole grains. There's not one word of drugs here or surgery. Not one word. The Seventh-day Adventists, they eat nuts and beans, and they live in a very closed community, probably because they eat a lot of nuts and beans. They have a very strong faith. The Okinawans keep lifelong friends. The people of Okinawa practice a thing called Hari Hachu Bu. I apologise for any Japanese people in my pronunciation, which means eating to only be 80% full. Now, I don't know whether they have a fullometer in their stomach that tells them when to stop, but they never eat to feel full. And also they find a purpose in life. And they're the simple ways to live longer, rather than worrying about all this nonsense of new drugs and better surgical procedures, etc., etc. Now, the ancient killers, as I said this morning, were either trauma or infection. You see on the next slide the barrister saying to the crocodile, well, of course I did it in cold blood, you idiot, I'm a reptile. That's the ancient way of being killed. But the modern ways, in our modern societies, everybody in this room is now living in a modern technologic society. 45% of you will die of some form of cardiovascular disease. 45%. 30 to 40% some form of cancer. In 1920 it was only 3%. 10% of Australia, adult Australians, are now type 2 diabetics. 1 in 10 people. And 70% of Australian males, 50% of Australian females, much less in Asia of course, are either overweight or obese. And also then there's the scourge of Alzheimer's disease, which as the population gets older will become more common. And I actually believe, and I won't have time to talk about it today, I believe in the vast majority of cases Alzheimer's disease is preventable, but not when people get it. You've got to stop from getting it. All diseases in the modern world are due to something that shouldn't be there in the first place. So, for example, in my specialty cardiology, one of the key things that causes disease is what we call inflammation. Now, let me explain to you how this works. We all hear about cholesterol, blood pressure, I've mentioned cigarettes, diabetes, and having a family history of heart disease. They're the 5 key risk factors for heart disease. But how does it all start? This is a normal artery with a hole going through it in the middle. It looks a bit like a donut, which will be a bit relevant later on, I assure you. But there is not one person in this room that has normal arteries. Because the second your mother gives you baby food, you start spilling a little bit of fat into the wall of the arteries. And over decades, you can see there that yellow bit at the bottom of the artery, over decades that swells out. Now, most people have the misconception that in heart disease, cholesterol slowly closes your arteries over. That's complete nonsense. If you imagine a donut, wide open channel down the middle, that's where the blood's going, all the fat's coming out this way. When it reaches a critical mass, there's no blockage, it suddenly just goes like this, suddenly. So it's not a slow blockage. So what shouldn't be there in the first place is excessive nutrients and excessive pressure. Hunter-gatherers have cholesterols below about 3. For the Americans, I think that's below about 100. And a blood pressure top reading below 100. They didn't get any fat in their arteries. But anyone whose cholesterol is above 100 or 3, depending on which units you use, and top reading blood pressure is above 100, will get fat spilling into their arteries as time goes on. And then you have these little cells, which are the immune cells, which are like the security guards of the body. They follow the fat into the wall of the artery and they start chewing on the fat. And they go, gee, this tastes nice. So those cells become obese themselves. And they chew more fat and then they rupture into the artery. So it becomes a process of what we call chronic inflammation. And that's what causes heart disease. That's the whole cause. Blood pressure, too much nutrition, and then a chronic inflammatory response with it. And you see, here's the problem. We often talk about the Mediterranean diet as being the best diet on the planet, which in my view it is, but it's not in fact the diet, it's the lifestyle. What do the people in the Mediterranean who live a proper Mediterranean lifestyle do? They have a good-sized breakfast of natural fruits and whole grains. They burn off any carbohydrates in the hot Mediterranean sun during the day, working in the fields. Then they have their biggest meal at lunchtime, pasta, a glass or two of red wine, makes them sleepy. They have a sleep after lunch, and they burn off any extra carbs in the afternoon and don't have much to eat in the evening. What do? Small breakfast, small lunch, sit in our bums all day, big evening meal, and sit in front of television. Now here's the problem. The body's not like a car. With the car, you put the fuel in, you use the fuel when you need to. If you don't burn the fuel that you put in here, it gets laid down there. That's what happens. It's very, very straightforward. So even though I greatly believe in the Mediterranean diet, it's more their lifestyle. It's the whole thing. Now, Michael Mosley wrote a book called The Fast Diet. And it's very straightforward. It simulates being a hunter-gatherer. You have a couple of non-consecutive days per week where you don't eat much. You don't need to buy the book, although Michael wouldn't like me saying that. All you need to know is to have 2 days, not consecutive, where you don't eat a lot of food. It's not difficult, but it simulates being a hunter-gatherer. And a couple of days when you don't drink alcohol. All of those things will help you keep your weight down. I wrote a book 7 years ago called Diets Don't Work, because diets don't work like 12-week programs don't work. Because what happens when you go on a diet? It's like going on a holiday. You come home from the holiday. You stop your diet after 12 weeks and then all the fat comes on again. The only thing that does work is having a lifelong commitment to being healthy, which means eating less and moving more, basically. And where did all this cholesterol nonsense come from? Because we hear so much rubbish about cholesterol. It all started with this man here, Ancel Keys. He was a Minnesotan biochemist, and he decided in the 1950s that cholesterol and saturated fat caused heart disease. Now, if you can figure this out, you're a much smarter person than I am. He looked at 22 countries and released the results of 6 in a trial he called the 7-country study, because 16 out of the 22 countries didn't fit his hypothesis. And so we've lived on this high fat, high cholesterol is bad for you nonsense for the last 50, 60 years because of this man. Because there was a fellow in the UK at the same time who said, no, it's not fat that the big problem is, it's sugar. And the food industry said, we don't want that to happen, because if everyone believed that sugar was that bad for you, people would stop eating processed packaged foods and drinking those horrible things called soft drinks that I'll talk about in a second. So I don't treat cholesterol. I'm a cardiologist. I don't treat cholesterol at all. I treat risk. If you're at low risk for heart disease, I couldn't care less about your cholesterol. If I've deemed that you're at high risk, then I will treat your cholesterol, because I'm treating your risk, not your cholesterol. I can guarantee that probably 10%, maybe more, of people in this audience are taking a pill to lower their cholesterol, and I would suggest to you that maybe 1 in 20 of those people it's necessary. The only people who should be taking cholesterol-lowering pills are people who have already had a heart attack, a stent or a bypass, or people on a coronary calcium score have a high level of coronary calcium. I don't care. If your score is 0, I don't care. The US put out a study last year. They looked at 5,000 people over 10 years. 77% of those people fitted the US criteria to go on a statin drug to lower their cholesterol. The biggest selling drug in the world, Lipitor. 77% of them fitted the criteria. half of them had a 0 calcium score, and at the end of the 10 years, the conclusion was it was worthless, them taking a pill to lower their cholesterol, because their event rate was so low. I'll just tell you a story. I saw a 35-year-old man who came to see me for an opinion about his cholesterol. He was on 40 milligrams of this treatment, Lipitor, and I said, "What are you taking this for?" 35-year-old. He said, "Because my cholesterol's high." I said, "Yeah, what are you taking this for?" He said, "Because my cholesterol's high." I assessed him. There was nothing wrong with his arteries. He was only 35. I said, "Your rate is so low, you don't need to be on the pill." But he went on to tell me that he and his wife had been through 3 unsuccessful cycles of IVF. And I said, "Well, there's your answer. You're taking Lipitor." I stopped the Lipitor because he didn't need it. Within 6 months, she got pregnant. Now, I think that is disgusting that a woman has to go through the very unpleasant procedure that is IVF because some idiot had put her husband on a pill to lower his cholesterol that he didn't need in the first place. It was outrageous. And this is happening all the time in medicine, and it's got to stop. That's why I make this noise as much as I do in forums like this and on my radio shows and everything else. It is wrong. And then we've been told about low-fat food. It's any food that, if you've got a box with graffiti written on the side of it, low-fat, no cholesterol, you know it's rubbish. Because they're putting in it salt, sugar, all of these dreadful additives. So don't believe this nonsense about low-fat is good for you. It is nonsense. And this shonky little place is a thing called Cambridge University, one of the greatest institutions in the world. They came out with a study, so don't just believe me, let's believe the scientists at Cambridge. 600,000 person meta-analysis, 72 trials, showing there is no link between the intake of meat, eggs, dairy and heart disease. Never has been, never will be. It is complete and utter nonsense. So get that out of your head. Meat does not cause heart disease. Eggs are good for you. Doesn't cause heart disease. And dairy does not cause heart disease. Complete nonsense. Now I want to tell you a story about a 50-year-old man who came to see me from the age of 40 to 50, had 7 of these stents in his arteries. So when you have a blockage, you can see over there on your left, they put this deflated tube in, blow the tube out, pull it out, and leave this little metal scaffold called a stent in your arteries. Imagine having 7 of those from the age of 40 to 50. So I said to him, "What's a 50-year-old doing needing 7 stents?" And he said, "That's the same question I asked the 9 cardiologists I've seen before you." I said, "Well, let's find out." And doctors aren't doing these tests. So I did these tests. This says, I would have been here much later, but my cardiologist thought he'd fixed everything with a stent. So just because you've got a stent in one blockage, it doesn't mean anything's been done to the underlying process of fat build-up all through your arteries. You've got to treat the whole process, not just one blockage. A bypass is not curative. It just bypasses those blockages, doesn't treat the underlying process. What I do in my practice, I find out why, I treat the why, and I reverse the why. It's very straightforward. So, for example, who in the audience, keep your hand down, Kev, who in the audience has heard of lipoprotein little a? LP little a. One person? Well, let me tell you, 1 in 5 of you have a high level of this thing in your bloodstream. It's the most common genetic cholesterol-carrying protein, and your doctors aren't measuring it. And if you do, you have a 70% higher risk for heart disease. That's one of the things that this man who had the 7 stents had in his arteries. An aspirin a day will prevent a heart attack if you have it for lunch instead of a cheeseburger. That's just a little thing I threw in there. Now, here's another misconception. Who's heard of, show of hands, who's heard of the good and bad cholesterol? Okay, most people have heard of good and bad cholesterol. Well, that's wrong. So most people think that LDL is bad and HDL is good, and that's not actually true. And this is what it's all about. It's the size of the molecule. So there's small LDL, which is bad, small HDL, which is bad, large LDL, which makes up most of your cholesterol, is good, large HDL is good. And nobody's even measuring these things. There's some very sophisticated tests now in the US, and we have them in Australia, where we are measuring these things, but our government's not paying for it. People have to pay for it themselves. But this man with the 7 stents had a high level of lipoprotein(a), that you can only get it by picking the wrong relatives. And he also had a high level of small LDL and what we call oxidized LDL. I treated all of these things, and within 12 months his heart was back to normal. No more problems. Now, I spoke this morning about this bergamot fruit. The bergamot comes from this part in Italy. It's the southern tip of Italy. I am an honorary Calabrian citizen because of my services to the bergamot fruit, so I know all your addresses. Just be careful. And what this stuff is the juice of the orange. And the juice of the orange has a very powerful effect. If you're on a cholesterol-lowering pill, you can take less cholesterol-lowering pill because this thing augments the cholesterol-lowering effects of statins. It also shifts you from small LDL to large LDL, exactly what you mightn't see it in the blood test, but you can certainly see it if you measure the subfractions. Everybody with metabolic syndrome, which I'll talk about in a second, should be on this, and anyone over the age of 50. Now, what is metabolic syndrome? Metabolic syndrome is the commonest syndrome in the world. And let me explain to you what it is. You can see here, through evolution, how men have evolved to the last person there on your right. So, metabolic syndrome comes from a thing called insulin resistance. 30% of Caucasians, 50% of Asians, and 100% of people with African Americans, subcontinent Indians, 100% of people with darker skin are born insulin resistant. Why? Because it's a survival advantage if you're a hunter-gatherer. It's a survival disadvantage if you're here. So how do you know if you're insulin resistant? Okay, well, let me go through it. Firstly, you have a tendency to diabetes. Secondly, your blood pressure is abnormal. Thirdly, cholesterol's up, triglycerides up, HDL's down. And fourthly, fat around the belly. So people are getting like this, what John this morning called the royals. People with a lot of fat around the belly are significantly insulin resistant, and all of this leads to cardiovascular disease. So 50% of women are what I call in my books G-types, where they have the rather large backside like Serena Williams here, but that doesn't hurt. What hurts is this. And you see here, impolite as they were, the other bears could not help but just stare at Larry's enormous deer gut. And this is the dangerous fat. The more fat there you have, the worse it is, and people who are significantly insulin resistant have the big bellies. Now, what happens in a heart attack? I mentioned you suddenly rupture your artery. So see the little crack in the bottom of the artery there where the yellow bit is. And this is another look at the artery. The white bit in the wall is the fatty plaque. It suddenly ruptures, and that red bit is the clot that forms in 10 minutes. So 10 minutes before your heart attack, your artery's open. So that's where, for example, the executive stress test is a complete waste of time. It tells you nothing because you can go in with a nice open artery and the stress of the exertion on the stress test can rupture the artery and you have your problem. So we don't need to do stress tests. We need to look at the wall. And it's what puts the fat there in the first place. I've already mentioned the genetic and the environmental cholesterol issues, blood pressure issues, diabetes, cigarettes, etc. But what makes that fatty plaque rupture? Completely different things. There are 5 categories there. Number 1, and most importantly, are what I call psychosocial factors. People who get angry, people who get anxious, depressed. So let's go through those. Wait for this, within 2 hours of getting acutely angry at anybody, you increase your risk for a heart attack 8 times. There's a wonderful Buddhist saying, it says, you're not punished for your anger, you're punished by your anger. Pretty horrible punishment to have a heart attack because of it. And I love this one. Anxiety. People who suffer chronic anxiety. If you get acutely anxious on top of your chronic anxiety, 7 times higher risk for a heart attack. Depression. Depression is not a psychologic disease. Depression is a physical disorder of the brain giving you low what we call serotonin levels. People who have depression have a 50% higher rate of heart attack because of all the bad stress chemicals that are being released and the fact that people who are depressed don't look after themselves as well anyhow. Feeling of isolation. You see here for the 100th time in as many days I haven't got a quarter. People who feel isolated also don't have social connection, much higher rate of heart attack. And also any acute life event, the death of a loved one, very, very common cause for other people, for someone who loves you, once you've died, for them to have their heart attack. And also work stresses. There's been this long study that's been going on for years called the Whitehall Health Study done in Britain, and they found very clearly in British civil servants, those who were under more job strain had much more heart attack than those who weren't. Any acute disasters, this was the Northridge earthquake in 1994 in Los Angeles, and this horrible occurrence. On the day that 9/11 occurred in the US, there were 7 times more heart attacks all over the US, not just in New York, because of the stress to the community of having to endure this dreadful, dreadful situation. 7 times higher rate of heart attacks on that day. But also people who do unusual exercise. So the fat guy who runs for the bus, or someone who says, oh, look, I've got to start getting myself fit and does a 10K run. It's a great way to, like squeezing a pimple, suddenly pushing on that fatty plaque and making it crack open. But also dietary excess. People who overeat consistently and really have a big meal, this can also cause a heart attack. And there is a place in America called the Heart Attack Grill, and you see the quadruple bypass burger there. It does exist. And what's the paleo diet? People who go on to these fad diets, that is not good for the body as well. If you're a 30-year-old starlet wanting to lose a bit of weight quickly for a movie, that's okay. But when you get to 45, 50, if you rapidly lose weight, it pours into your central circulation, overloads the circulation, and can precipitate a heart attack. So you don't do radical things. Extremes aren't good for the body. And a lot of people don't realise this, but infections can also activate the immune system, which will then erode into a fatty plaque and cause a heart attack. So, for example, everyone over the age of 50 should have a yearly flu shot. A study came out of Australia last year showing that people over 50 who had a yearly flu shot had a 30% reduction in heart attack because of the reduction of influenza A especially, which can cause nasty problems in your arteries. People don't think about that. I've seen people having a bad episode of pneumonia go on to have heart attacks as well. And this is just an interesting one. Any sort of toxin, whether it be illegal drugs, so people who regularly use stupid things like cocaine or ecstasy, you can rupture fatty plaques. I've seen people in their 20s and 30s have heart attacks, sudden cardiac death by using this sort of nonsense. And this is just an interesting story. I had a 35-year-old tennis coach come to see me who, for a reason, he couldn't explain this to me, and he still can't to this day explain why he did this. Within the space of an hour, he had 3 double-shot cappuccinos, which sent him into this heart rhythm called atrial fibrillation, where the heart just beats all over the place. And he developed a cardiomyopathy because of the atrial fibrillation. What I'm saying is don't do excessive things because they don't help you. And I've showed this one this morning. Some wolves, their habitats destroyed and overwhelmed by human pressures turned to snorting quack. Don't use illegal drugs because it's another great way to have a heart attack. Now, I'll move on to cancer. The best cancer prevention technique is to use the organ for what it was designed for. And a lot of people don't realise this. You've got these things in your chest called your lungs. They were actually designed for a thing called breathing, not to put a white stick in your mouth and suck the smoke in. It's a real shock you get lung cancer from that. That's what happens. The human prostate, this is for the males, was designed to be regularly emptied. The more you empty your prostate, gentlemen, the less prostate cancer you have. The reason why older guys get prostate cancer is their sexual activity drops off. The more you empty the prostate, less prostate cancer. You give me any organ and I'll tell you why people get cancer from it. The brain wasn't designed to have these mobile phones stuck to the ear all the day. Every single cancer. I could talk about breast cancer for the next 20 minutes. Same deal. Don't get your prostate examined in that way. So how far should we be screening people? I mentioned this morning about the CT scanning. Just going to a doctor and look, every time anyone over the age of 30 goes to a doctor, they always should have their blood pressure checked. Very important, but it's not enough. Just having a bit of a checkup with a doctor is not good enough. So I mentioned the CT scanning this morning. I also do a technique at my practice in Sydney called arterial stiffness measurements or arterial screening. I measure every pulse coming out of the heart. It's completely painless. You put it over the wrist there, and it's a way of monitoring the arteries over the years. And it's a very good way to see that my treatment's working, the lifestyle plans are working, etc., etc., etc. And that's something we do in Sydney. It's available all over the world. Regular mammography over the age of 50. Now, this is something. People are concerned about radiation, and I am up to the age of 50, but over the age of 50, the cells are less responsive to radiation, so it's not as dangerous for your body. You won't get the cancers over it. You don't start screening at 35 with coronary calcium scoring or mammography, but over the age of 50, there is some pretty good evidence to show that regular mammography every couple of years can reduce the breast cancer risk, picking things up early. And come on, Jim, it's now time for your colonoscopy. I already mentioned that today, but I'm just reinforcing the vital importance. Everyone at age 50, what you should be doing at 50 is having that colonoscope once. And also the appropriate blood test. I mentioned lipoprotein delay, sugars, the cholesterol profile, etc., etc. There's just so many accurate things we can do now. If you're in the US, there's a thing called the VAP test, which looks at the small LDL and the large LDL and everything else. Very, very important stuff. So let's go through the 5 lifestyle keys just to reinforce what I was saying this morning, because they're very, very important. Smoking's just a no-brainer. So there's dumb ox. Drinking debauches and destroys mankind. Well, I don't think we should go that far with this. In fact, the evidence shows that moderate drinking, 1 to 3 drinks a day, does reduce cardiovascular risks in the 20 to 30% range. So don't believe all the stuff about alcohol does this. And in fact, the studies that show the best benefit from alcohol are the studies that were done in combination with the Mediterranean diet, as opposed to the American studies where they combine typically alcohol with a less secure diet. And then the next one here, this is, wait a minute, did I floss? I'm not sure what that was even doing there. That should come in later. But anyhow, that aside, diets that are highest in polyphenols or plant chemicals, 30% reduction in mortality. Just having fruits and vegetables like I mentioned today. Blueberries, great for the brain. Extra virgin olive oil. Extra virgin olive oil comes from really, really ugly olives. No, that's not true. No, extra virgin olive oil is the first pressing of the olives. It's the most natural form. And here's one of the con jobs of the food industry. Where you see extra light, they can't even spell light properly, you think it's better for you than the other stuff. But in fact, extra virgin olive oil, the first pressing of the olives, is much better for you than extra light olive oil, because they both have the same amount of monounsaturated fat, which is very good for you, but they've taken all the polyphenols out of the extra light olive oil. So you always use the extra virgin olive oil. The people of Crete cook in the stuff, they dip their whole grain bread in it, and they also put it on their salads. It's fantastic for you. A study's just come out recently saying that frying your vegetables in extra virgin olive oil is better for you than steaming them. There you go. Ah, man, the coffee's cold. They thought of everything. What's the story here with coffee? Is coffee good for you or bad for you? Well, the reality is little bits of coffee and tea are actually good for you. If you have a couple of cups of coffee every day or a couple of cups of tea every day, very good for you. So people who have 2 cups of good quality coffee every day reduce their risk for gallstones, kidney stones, Parkinson's disease, Alzheimer's disease. Yeah, the 3 advantages of having Alzheimer's disease. Number 1, you get to meet a new friend every day. Number 2, you get to hide all your own eggs at Easter time. And number 3, you get to meet a new friend every day. It also, having a couple of cups of good quality coffee every day, reduces your risk for many common cancers, type 2 diabetes, depression and stroke. So it's a good thing to have a couple of cups of coffee every day and also a couple of cups of tea every day because of the polyphenols. It doesn't matter whether it's caffeinated or decaf, the polyphenols in the coffee, in the tea are what's good for you. Does anyone here like chocolate? Well, 2 pieces of dark chocolate every day, 2 small pieces of dark chocolate every day, drops your blood pressure, opens up your blood vessels. Very good thing to do. Again, in dark chocolate, the polyphenols are the key there. And I mentioned red wine. The reason why red wine is better for you than other forms of alcohol are the polyphenols. There are 10 times higher concentration of polyphenols in red wine compared to white wine. And there's no polyphenols in beer or spirits. And a couple of studies out of the Mediterranean showed a 50% reduction in heart disease and cancer in people who have a couple of glasses of red wine every day. So what about body well-being? Firstly, it's about achieving ideal body weight. It's also about fitness. It's about musculoskeletal well-being, sensory well-being, and then beauty is skin deep. But I'll just go through a few of these. Now, the advertising people tell us if we're a male, we should look like this. If we're a female, we should look like this. But unfortunately, some of us end up looking like this. And the answer is probably somewhere in the middle. And one of the key ways of doing that, of keeping your weight down, is calories in versus calories burnt. But it's also having the right sort of exercise. And it's not just about having cardio. And I think we should be dividing our exercise to 2/3 cardio, 1/3 strength training, resistance training. But with that, we also need stability, agility, and flexibility. So it's not just having either running or swimming or cycling or something like that for the cardio. And I wish exercising was as easy as eating. It's also about having some sort of strength training, but not to look to this ridiculous level. Does running late count as exercise? I don't think so. Balance is the key to life, as it is with exercise. And having agility as well, which is defined as having the characteristics of speed and coordination and the ability to react quickly and appropriately to change. It's life anyhow. And this is agility. There's just one there for the New Zealanders in the audience. They're the All Blacks. But it's also flexibility. Things like yoga, incredibly good for you. And I tried exercise once, but I was allergic to it. My skin flushed and my heart raced and I got sweaty and short of breath. Very dangerous, very dangerous. And I've mentioned this morning the enormous benefits from having 3 to 5 hours of exercise every week. And eat less and exercise more, that's the most ridiculous fad diet I've ever heard of. So I do believe very strongly that exercise is the second best drug on the planet, as I said this morning. But then what about energy? We have to have energy during the day because as you get older, you do get more tired. And firstly, to realise that we work on a 24-hour cycle. So you've got to get the right amount of sleep. And I think we have about 8 hours of active energy, 8 hours of relaxation energy, and you should sleep for 7 to 8 hours. I said this morning, 7 to 8 hours of sleep is as good for your body as not smoking. But it's also the energy at the cellular level. And I'll go into the coenzyme Q10 thing again. Why do we get tired? I'll talk about that. Chronic fatigue, I won't mention too much about that, but there is a thing called chronic fatigue syndrome. Then we'll talk about sleep. So we need active rest and sleep for our energy. And one of the things we have to do, and this is, I showed a picture like this morning, is keep those mitochondria healthy. Now remember, your car doesn't work without fuel. Your cells don't work without this energy source that you get from coenzyme Q10. Now coenzyme Q10, in its active form, is a thing called ubiquinol. So if you take just standard coenzyme Q10, you're not getting the right stuff. It's ubiquinone that has to be metabolized to ubiquinol. And as you get older, you lose the enzyme that shifts that. And I think that once you get to a certain age, if you want energy, unless you've just got enormous energy, you should be taking 150 milligrams of ubiquinol every day, along with this stuff, magnesium orotate. And it's not the magnesium that's important, it's the orotate that lifts up the coenzyme Q10 in the mitochondria to give you that energy. Now, why do we get tired? Well, the biggest cause of being tired is stress. So people who are stressed, they're working too hard, playing too hard, something's going wrong in their life, they get tired. Then there is depression. Now let me explain to you about that. I mentioned it's low serotonin levels, but the symptoms of depression are tiredness, loss of zing, so things you used to look forward to, you just don't care about anymore. And the other cardinal feature of depression is waking at about 2 o'clock in the morning and you can't get back to sleep for an hour or so, for no good reason. You might just stare at the ceiling, but because you have that disruption of your sleep. The two other serious symptoms of depression, not that those aren't bad enough, is a sense of hopelessness and suicide, committing suicide or attempting suicide. So when you hear about someone who's taken their own life, they don't do it because their life is bad. They do it because they have severe psychotic endogenous depression. And when you can recognise the signs that I've said earlier, you can do something about it. So it's a serious disease and it's something that needs to be treated. So any of those symptoms at all need a proper medical assessment. When you hit 45, 50, the hormones start to drop. Women, all women go through what's called menopause, we've all heard of that, but 50% of men go through a similar thing called andropause. And what happens in that is the testosterone levels drop. And that's a very, very common, all men go through it to some extent, but 50% of males will have significant andropause where, like women, they'll need a different form of hormone replacement therapy. Any medical problem at all can cause you to feel tired. So I've had a number of people who their only symptom of heart disease was unbelievable tiredness. If you have something like rheumatoid arthritis, you feel very tired with the condition. An underactive thyroid, being anemic for any reason, that can also make you incredibly tired. My mother, who's now no longer with us, came down to visit us, this was about 10 years ago, and she was incredibly short of breath and incredibly tired. And I'd never seen her like this, and I hadn't seen her for about 9 months because she lived about 600 k's away. And I said, "Mum, you're not well." And she said, "Yes, son, I'm not well." And I said, "Mum, have you any change in your bowel habit?" And he probably took a history and took off my son hat and put on my cardiology hat and doctor hat. And she said, no, son, no problems at all. So I ran some blood tests, and her hemoglobin, which is the red cell count, had dropped down by half. I said, "Mum, you sure you're not bleeding from it?" "No." "Any change in bowel habit?" "No." "You on any new medications?" "No." I said, "Mum, do you take aspirin?" She said, "Yes, I take aspirin, son." I said, "Why do you take aspirin?" She said, "I read it was good for the heart." I said, "Mum, you may have missed out on this, but I have been one of Australia's leading cardiologists for the last 25 years. You could have asked me." And she said, "I didn't want to bother you, son." I said, "Well, you're bothering me now, woman." We got a gastroscopy done. She'd wiped out her stomach and lost half her blood volume just from, in her case, not needing to be on aspirin. But she was unbelievably tired, which was the major symptom that she had. And any sleep problems can cause it as well. So stress, I'm finally learning how to relax. Unfortunately, relaxation makes me tense. And these are signs of depression. Any depression can make you feel tired. I have to run a few tests to be sure, but I'm guessing it's either hot flushes or global warming. But I feel wonderful, Doc. Optimism is extremely contagious. Any disease can make you feel tired. And insomnia is very common. Try not to lose any sleep over it. So let's talk about sleep for a while, because sleep is very, very important. The function of sleep is to rejuvenate our bodies, to repair our cells, to give us rest. If you don't have rest, you feel dreadful. And if you don't sleep, you'll be dead within about a month if you're lucky, probably a few days. The sleep-wake balance is vitally important, as is our 24-hour circadian rhythm. The circadian rhythm is the release of all these different chemicals in our body, the cortisol and all the different hormones. So if you had a certain blood test for any sort of hormones, they change throughout the day. They're not absolutely accurate because the levels do that all day depending on the stimulus. And that's our 24-hour circadian rhythm. And it's a taser, it's for your snoring. I mean, how many times has a woman wanted to have a taser? It's just, anyhow. So with sleep, firstly, the quality of your sleep really depends on the quality of your waking hours and vice versa. Also, there's preparation for sleep, what you should avoid and what you should encourage before sleep. Your sleeping environment's very important, so if you've got a noisy partner or you live on a main road where there's a lot of cars, that may affect your sleep. Even the feng shui of your bedroom's important. And the quality of your sleep itself is important. I'll talk about that, and also the 24-hour cycle. So, important bulletin, the FDA is warning of the adverse effects of some sleeping pills. There you go. So what are the 5 R's of optimum sleep? Firstly, you develop a routine. Go to bed at the same time, wake up at the same time. I mean, that's one of the problems for shift workers, people who do a lot of international travel. Your biologic clock is all over the place. So if you one morning wake up at 7, the next morning 9, the next morning 8, your body doesn't get used to that. So develop a routine. Be relaxed before you go to bed. Don't read some exciting novel where you're turning the pages and your heart's jumping out of your chest. You're not going to. Don't have a screaming argument with your partner before you go to sleep. You won't sleep. And this is the interesting thing, have a reducing temperature in your room. So we always sleep with the window open at home because we want the room to be cool. If the room is hot, you don't sleep as well, as we know on very hot nights. And if your relationships are poor and the person who you're having that relationship with in the bed is right next to you, you're not going to sleep well or as well, and be ready when you go to bed. So if you don't feel tired, there's no point going to sleep. You'll just lie there. So you have to feel tired and feel the need to go to sleep. And then there are specific sleep disorders. This may astound you, but 30% of the modern society suffers insomnia, which means they have either trouble getting off to sleep or they're waking up and their sleep's very disrupted. 30% of our society. And I think one of the big reasons this has become a big issue is because of all the electromagnetic radiation in our houses, the televisions. People sleep with a mobile phone or a cell phone under their pillow. I mean, I can't believe that anyone would do that to themselves. You don't need to be on 24-hour call. Go and put the thing out in the bathroom away from you, but don't have the phone and the digital clock right next to your head. It will disrupt your sleeping. 30% of people. The commonest other sleep disorder is sleep apnea. Every male, adult male has it. Every postmenopausal female has it to some extent. 25% of males have it clinically where they need the treatment, the mask over the nose, 9% of females. And sleep apnea is just not an annoying thing for the partner. The major symptom of sleep apnea is you wake up in the morning feeling like you haven't slept. You look at your clock and go, oh, I could do with another 3 or 4 hours sleep, because it disrupts your good quality sleep. That's the problem. As your airway closes off as you get into deeper sleep, it closes off like that, you don't get any air into the body. So your body has to make a decision to stay in deep sleep with a closed airway, that's called death, or go to a lighter phase of sleep, and so you're never getting good quality deep sleep to rejuvenate your body. So it's very, very important, if you've got sleep apnea, that it's managed and treated. Restless legs is another thing. So I mean, a lot of women would know their husbands, or sometimes women themselves get restless legs where you kick each other in bed. Medical disorders can also disrupt your sleep, as does, of course, shift work and jet lag. And unfortunately, this is the definitive treatment for sleep apnea. There are some other treatments, mouth guards, and there's a few other things that do have some partial effects here, but you don't want to get to this point. The best treatment of sleep apnea is to shed 10 to 20 kilos to cut back on your grog and get rid of cigarette smoke. Then the next thing is optimum thinking. And there's no doubt, and you've heard a lot of the more motivational speakers over the last couple of days talking about this, but your thoughts do create your reality. Negative thoughts create negative reality. Thoughts are very powerful forces. There's the conscious awareness of, and this is the big thing. I'm giving a talk next week in Adelaide in Australia about mindfulness. And the whole key to mindfulness is to create that observer in your body that's monitoring everything that you do, to be consciously aware of what you're doing. And also the quality of your decisions and your choices will certainly help your health and how you think. And discipline and perseverance are keys as well. So this is the school for the mechanically declined. I certainly would join that one. But the 5 keys to mental sharpness, if you want to maintain your intellect and the way you think well beyond your formative years, number 1 is to keep working. People who either stay working or keep their interest in their profession have much greater intellects than people who decide to retire and just stop using this. Use it or lose it. It's a very, very simple principle. And change is the only constant. You have to be open to change. People who aren't open to change, there's an issue. And hang around with optimistic people. Optimistic people are if you hang around with people, and you find this as you get older, people, all they want to do is talk about their illnesses. People come to me all the time, all they want to do is talk about their illness. No, I'm joking. But you don't want to go to a dinner party and discuss your health. That just doesn't work like that. And be optimistic yourself. So, interestingly, just going back to the use it or lose it, people who do crosswords, Sudokus, brain training exercises, people who learn new languages. So people who are bilingual have less Alzheimer's disease than people like myself who only speak one language. People who play a musical instrument beyond the age of 50 have much better brain connections, because Edward de Bono, one of the greatest minds of last century, did all the lateral thinking stuff, talks about thinkings like running a tap down a hill. If you just run from one water source, you get this ingrained source down to the bottom of the hill. The rest of the hill doesn't get watered. So if you think the same way, do the same things, don't change anything you do, you're not watering all of your brain. Whereas if you're playing an instrument, or if you learn a language, or you do different things, brain training, etc., you're watering all of your brain and keeping that brain sharp. So as I said this morning, the key health benefits from all of the things I'm talking about here are a 60 to 70% reduction in all diseases just by working on your lifestyle. And that's just extraordinary that people don't get this point. They're happy to keep abusing themselves and ignoring us, taking all these pills and doing nothing about it. So let's get on to this, emotional wellness. There are 5 keys to this: silence, service, the intention you bring into every moment, conscious awareness, living in the moment, and balance. So I believe everyone needs a half an hour off the merry-go-round of life every day of their life. What I've been doing for the last 25 years is meditating every day. I do at least a half an hour a day, sometimes an hour every day. And people say, oh, it's a waste of time, I haven't got time for meditation. If you have the regular practice of meditation, you have clearer thinking, clearer emotions, 50 to 60% reduction in heart disease and cancer just by meditating every day. So I'd strongly advise all of you to develop a habit of meditation. But also to have a service mentality as well. I think all of us are servants. And anyone who thinks they're anything more than a servant really should examine their life. And this is probably the greatest servant we've ever had on the planet. Have a servant archetype. I think it's really important to develop that. Have balance in everything you do. Balance in your physical side, in your emotional side, your mental side, work-life balance, and of course your spiritual side. Balance in everything. Extremists in anything on the planet are destroying the planet, as we all know. And happiness to me is the key. And part of being happy is to have a life purpose, something that gets you out of bed every morning. Whether there is or isn't something beyond the grave, I don't know, not up to me to say that. But I think it's important to have a life purpose, whether it is belief in a higher being or whether it's just belief in your family or belief in what you do. And the power of language, the things that comes out of your mouth, vitally important. Don't take anything personally. And people don't think that. So many people hear people say things, oh, they're directed at me or that person doesn't like me. It's their business. What people think of me is their own business. It's got nothing to do with me. It's your issues, not my issues. Don't seek power over other people. That's also important. And always do your best in everything you do. If you cultivate all of those things, I promise you, you'll be happy. So this is just, on the other hand, what if we aren't alone in the universe? It's important to have a life purpose. And life purpose, I think the only function of life is spiritual evolution. And in my opinion, that's becoming a better person every day of your life. It's got nothing to do with religion per se, but I will tell you, if you took all the people who fell asleep at church and laid them end to end, they'd be a lot more comfortable. And I think what you should do in your life is see every day and everything that happens to you as symbolic. Good things happen, bad things happen. What can you learn from everything there? I've already mentioned conscious awareness and silence, living in the moment, because this is all you've got. What happened yesterday? What you might have regrets or concerns about what happened yesterday, you can't change that. You can't change what might happen tomorrow. All you've got is right now and what you're bringing into right now. And with that is balance. And then there's symbolic living, which I'll get onto that in a second. This is an interesting one. There was a study that came out of the US last year showing that there's a direct inverse relationship between a feeling of gratitude, which I've heard some of the speakers talk about in the last couple of days, versus materialism. So the more materialistic you are, the less gratitude you feel, but the more gratitude you feel, the more you score on happiness scales. So these sort of things, flashcards like this, might make you happy for a week or two, but what really makes you happy is to develop an attitude of gratitude to everything that happens in your life. And in fact, if you kept a gratitude journal, you wrote down every day 5 things you feel grateful for, at the end of a week, your happiness score has gone up 30% just by feeling gratitude. And the power of language is really important. Descartes said in the 1600s, I think, therefore I am. And if you listen to people who are negative or people who are always criticising someone else, it says everything about them and not about anyone else. So always try to talk positively. Always try to think positively as well. Don't put yourself down. The most important relationship you'll ever have with anyone is the relationship you have with yourself. So think positively. Your internal thoughts do create your reality. Be positive and also be impeccable with your word. Always speak the truth, because every time you don't, you're bringing yourself down. You're not conning anyone else, you're just conning yourself. And see beauty in every moment. Just see the privilege it is just to be alive. It's just extraordinary if you have that attitude. And you see here, Wendell, I'm not content. And as I said, don't take things personally. There's a fellow called Abraham Maslow, who was one of the greatest ever psychologists, and he talks about being a free thinker and a no-limit person. And one of the big things is to live independent of the good opinion of other people. You never do anything because of what other people will think about you. You do things because you know it's the right thing. And as I said, what people think of you is their own business. And this says, one of the nicest evenings I've ever spent at the Wilsons, and then you had to go and do that on the rug. And I want to tell you one of my favourite jokes. It's a little bit, I think I'll get away with this, Brad, but it's a great joke about the fellow goes to the doctor and he says to the doctor, "Doctor, my penis is so long it's tugging on my vocal cords. I'm wondering if you just remove a bit." So the doctor takes him to the theatre and he removes the appropriate length. And he wakes up from the operation, he goes, "Excuse me, my voice is back to normal. This is magnificent. I could talk, I could sing." He's so happy. But he found that once he's had the length taken, he's lost a bit of prowess. So he goes back to the doctor and he says, "Look, doctor, I don't wish to sound unappreciative. I can talk, I can sing, it's terrific, but since I've lost a bit of prowess, is there any way you could sew it back on?" The doctor goes, "I'm afraid that won't be possible." Probably got away with it. Don't seek power over others. Only you can make you happy, and don't make assumptions. When you hear people talking or when you've heard someone said something bad about you, don't make assumptions about it. It's all about them, not about you. So if you want to make yourself very unhappy, listen to what other people are saying about you, because they'll always say things that are not going to make happy. It's all about you. And always do your best. Detach yourself from the outcome. Don't say, "I'm doing this because I'm getting this out of it." Just go through your life with the attitude, "How may I serve?" I think it's the best thing you can possibly do. I wrote a book, here's another shameless plug, called The Life Factor, which is about how to manage stress. All these books are available on my website, drrosswalker.com, they're as ebooks. And then finally, talking about emotional wellness. Because with emotional wellness, this is the way to feel happy. Show love to everybody. Now, I'm not talking about passionate love here, I'm just saying love and respect. Feel compassion for people who don't have your privilege. Feel empathy for people. Try to understand how other people are feeling, not just how you think they should feel, but how they're actually feeling themselves. Be grateful, as I've said before, and forgive. One of the most healing things you can do for anybody is to forgive them. So when you hear people, and look, we've all been traumatised by something, but when people wear that wound on their sleeve 10, 20 years later, the most healing thing they can do for themselves, not for the perpetrator of their trauma, is to forgive and move on and live now. That's the most important thing you can do, forgive. And I'll tell this one wonderful story about Pope Francis. And this is just about showing love and respect to people. When he became the Pope, and I'm not a Catholic, I just think this is a wonderful story. When he became the Pope, he was the Bishop of Argentina. And he used to walk past, get his paper every morning from the news agency and go to the cathedral. So he goes to Rome, becomes the Pope, knows he wasn't going back to Argentina pretty soon. So he personally rang the newsagent to thank him for his wonderful service over the time. Now, can you imagine you're sitting there in your news agency in Argentina and hello, it's Pope Francis on the line. He didn't believe it initially, but he actually took the time to ring the man to thank him. And how wonderful is that a person who's reached his position can still have it in his head that he wasn't going to pick up his paper in Argentina anymore, and he rang and thanked the man. I think that was just extraordinary. Mahatma Gandhi, "My life is my message." And I think that says it all about compassion. And Confucius says a journey of 1,000 steps begins with a single step. It's every small moment you take. If you want to change your life, you do it one step by one step. You're not going to see much change, but it is 1,000 steps. And this is my son in New Zealand. That's my eldest son now. He's now 36. He was only 18 there. He's about to go bungee jumping. A journey of 1,000 steps begins with a single step. And I want to finish off with what I believe to be one of my favourite medical stories. And this is not my patient, but it's just reminding me of this particular story about a guy called Alan. And Alan, I saw him first 22 years ago, and he came to me with the worst case of heart failure I have ever seen. His heart, when you do an ultrasound on somebody's heart and you look at the picture, that you see the heart going like this. His ultrasound, the heart was doing that. I could almost not see any movement. He had 20 extra litres of fluid in his body. And what I haven't told you about Alan, he was a 42-year-old tugboat driver who, when he wasn't driving the tugboats, was drinking schooners of beer. And he was drinking 20 schooners of beer per day on average. And what alcohol does is have a direct poisoning effect on your heart wall. So what happened with him is that he developed this severe dilated cardiomyopathy because of his 20 schooners of beer. So I said to him, Al, you've got a choice here. You keep drinking, you'll be dead within a month if you're lucky. If you stop drinking, you've got a very good chance of surviving. So he followed without me writing this down for him, he followed what I call my 5-point power program, which is this, the 5-step power program. Firstly, he made the decision that he wanted to live. And that's the first thing. When you're doing something in your life that you don't want to do anymore, make the decision you don't want to do it. That's number one. Make the decision. He made the decision. Then number two, interrupt the limiting patterns. Now what I mean by that, anything you do that you know is bad for you, there's typically some triggers. So if you want to give up smoking, but you go down to the hotel with your mates on a Friday and have a few drinks and you're not going to stop smoking. So you've got to stop doing that. I've got a patient who lives over the Melbourne Zoo, and she doesn't smoke during the day, but when she comes home, she goes on a balcony, looks over the view, relaxes and has a cigarette. Now, she's not going to stop smoking if she continues to do that because she has too many psychological cues associated with her smoking. So you've got to interrupt the limiting patterns. What's making you continue that bad habit, whatever it might be? In Alan's case, it was going to work and seeing his mates and going down and having the schooners. I said, you're not well enough to go to work, so I stopped him working. So we stopped his limiting patterns. But here's the big thing. Create a new behaviour. Nature abhors a vacuum. So if you're drinking 18, 20 schooners every day, that's a lot of your day. If you stop doing that, it's a lot of your day. You haven't got much to do. So what did Alan do? This was a 42-year-old knockabout tugboat driver. Good Aussie fellow, g'day mate, how are you? He developed a fascination with Egypt and he became an amateur Egyptologist. So he replaced his obsession with alcohol with an obsession with Egypt, which was very good for him. He enrolled in all these courses at university, learned everything he could about Egypt, and here's the killer punch. Every bit of money he used to spend on alcohol, he put into a bank account that grew very quickly because it's very expensive drinking 20 schooners a day, saved up enough money to take him and his wife Thea into Egypt to go through the pyramids when it wasn't that dangerous. And he said it was absolutely fantastic. And I've got to tell you a lovely story with Alan. He came to my, I saw him a couple of months ago. He's still doing superbly 22 years on. No heart failure, his heart's back to normal. But he came into my practice about 8 years ago and put a picture on my desk. And he says, Ross, this is my grandson, Jake. He said, I wouldn't be enjoying Jake if it wasn't for you. I said, no, Alan, you wouldn't be enjoying Jake if it wasn't for you and how you've looked after your body. So I'm just his coach. I didn't do the Olympic run. He did it himself because he made the decision. He interrupted the limiting patterns with a bit of help from me. He created a new behaviour all on his own. And then you've got to condition the behaviour. If you want to change any habit at all, you have to discipline yourself for 30 days to do the new behaviour. After that, it becomes part of what you do. But you have to make it a habit by 30 days of work. And then finally, you've got to live the program for the rest of your life. Forget about 12-week programs or anything else, or diets or all that sort of nonsense. Have a commitment to yourself to do this for the rest of your life. From today, if you're not doing it already. If you're doing it already, I congratulate you. So I said the 5 keys to ultimate health. But the 10 keys to living long and healthy lives that have been taken from all of these people who've had incredible longevity. Firstly, eat less and consume more natural food. It's very straightforward. Keep active throughout every day. Ensure adequate sleep and rest. Respect others, value family and community ties, and respect the older generation, which certainly in my country we've lost that respect. We just stick people in nursing homes and forget about them. Foster optimism, I've said that, and a positive attitude, laughing often. People with a sense of humour. I mean, some people think my jokes push the envelope a bit much. Get over it. Have a sense of humour and enjoy yourself. Live a simple life with little focus on material goods and wealth. Have a service mentality, practice gratitude and appreciation, and have a life purpose. Do you know, one thing about those 10 points I've made there? There's not one mention of drugs. There's not one mention of surgical procedures. Those things are stopgap measures until you get your life in order. So what I'm asking you all to do, like I was asking this morning, is like the little lemming there at the back, is to think differently. And again, if you think differently, who knows what will happen. We finished a bit earlier, but thank you very much.
I'd like to thank Ross again. That was fantastic. One thing you don't know about Ross is that he absolutely loves to have his photo taken, so please hang around afterwards. Ladies and gentlemen, this concludes the session. Thank you for coming, and please enjoy the rest of your meeting.